Recently, a number of veterinarians across the country participated in a Paul Animal Health CPET pilot program. They elected to treat their canine patients who failed to respond to conventional therapies for either osteoarthritis or tendinopathies with or without previous surgical interventions. As of June 2010, the participating veterinarians have treated 50 dogs with the CPET filter-based platelet harvest system. 21 have completed the 3-month post-treatment period, for which the follow-up data are now available. And this pilot program is ongoing. And here to share some information about the pilot program and the metrics used to assess treatment efficacy is one of the participating veterinarians, Dr. Lauren Blazer. Welcome.
Oh, thank you for having me.
So, Dr. Blazer, how many dogs did you or your practice have in the pilot program, and how did they react to the treatment?
Well, as of right now, I've done four dogs, and I'm hoping to do some more in the very near future. All 4 of my patients did very well with the procedure, recovered nicely from it, and had no adverse reactions. For the first 24 hours, they were a little bit sore, but no more sore than with any kind of joint injection that I do. And after that 24-hour period, they were back to where they were pre-procedure, and then from that point on, we were assessing if they were doing better than pre-procedure.
Well, in fact, the results you experienced are quite typical. Throughout the pilot program, there hasn't been one report of an adverse clinical reaction to the CPET treatment procedure. So, how did you qualify your patients as good candidates for the CPET treatment?
Well, in my practice, I'm pretty much 85% orthopedic patients, and all these dogs are suffering from severe to moderate arthritis of elbows, of the shoulders, of the knee. We've done some of the early kind of surgeries which are low morbidity, such as arthroscopy, and we're reaching the point where we have to start thinking about more invasive procedures such as joint replacements or other surgeries where we're actually making cuts in the bone, and it's just very expensive and very hard on the patients.
Yeah, it's very invasive.
It's very invasive, and a lot of these patients are getting to be a little bit older. So I'd like to try to give them some other alternative, and when you're talking about joint replacement, that is called a salvage procedure, so you try to give you something before that. And this new therapy with the platelets gives an opportunity to make these dogs better with very low morbidity and pretty much low cost to the clients.
So how did you go about assessing the progress in your patients? Did you share the Hudson Visual Analog Score, the VAS questionnaire with them?
I did. I think it's very important that the owners get involved with the assessment of these patients. These are arthritic patients. They have good days, they have bad days, and for me to evaluate them on just one solitary day isn't really giving a reflection of how these patients are doing. We need to see how they're doing over the days and how stiff they are when they wake up, how stiff they are after activity. Are they playing like a puppy, or are they getting old and hunched over when they're walking? Do they need pain medication, do they not? These are the kind of questions that the VAS asks, and these answers are very important in assessing these patients.
Well, thank you so much, Dr. Blazer.
Oh, no problem.